Good morning to one and all. I am Adina Rachel Manoj, here to present on site selection and techniques of insulin injection. Learning objectives. At the end of the session, the learner will be able to choose appropriate site for insulin injection, demonstrate correct technique of insulin administration. So now let's see what is insulin. Insulin is a hormone that lowers the level of glucose in blood by helping glucose enter the body cells. Human insulin is used to control blood sugar in people those who have type 1 diabetes or in people those who have type 2 diabetes that cannot be controlled with oral medications alone. Now, where to inject insulin? Insulin is injected subcutaneously, which means into the fat layer under the skin. In this type of injection, a short needle is usually used. If you inject the insulin deeper into your muscles, your body will absorb it too quickly. It might not last as long and injection is usually more painful. This can lead to low blood glucose level. Sites for insulin administration. The best places to give insulin are any 4 quadrants of abdomen, always at least an inch away from umbilicus, front or outer aspects of both thighs, upper outer area of buttocks, outer and rarer surface of upper arms. In this picture, you can see the insulin administration sites. Towards the right, you can see the pink color, which is the abdomen, where the insulin absorption rate is faster. Now let's see what are the steps for administration of insulin injection. Gather the supplies, check the doctor's medication order, wash your hands thoroughly with soap and warm water, check the expiry date of the medicine and identify the correct patient. At least check the medicine 3 times. Now, if you are using vials and syringes, these are the steps. Step 1. Clean the top of vial with an alcohol pad, then remove the cap from the syringe needle. Step 2. Draw air into your syringe, an amount equal to the units of insulin you will be injecting. Step 3. Put the vial on flat surface and hold it. Insert the syringe into the vial and press down on the plunger to inject the air from step 2 back into the vial. Step 4. With the syringe still in the bottle, turn the vial and syringe upside down. The tip of needle should be fully covered by insulin. Step 5. Make air bubbles less likely, slowly pulling down on the plunger. Draw insulin past your dose. Tap the syringe a few times so many bubbles rise to the top. Step 6. Without removing the syringe from the vial, slowly push the plunger until the edge of its black stopper reaches the number of units in your dose as marked on the syringe. If you see any bubbles, push all the insulin back into the vial and repeat these steps until no bubbles are present. Step 7. Identify an injection site. Pinch up a bit of skin. Insert the needle 90-degree angle. Hold the skin for 5 seconds to 10 seconds to ensure there is no leakage. Step 8. Dispose of your syringe and needles in the sharp containers. And these are the steps you can use if you are using an insulin pen. Important tips. You can numb your skin with an ice cube for a couple of minutes before swabbing it with alcohol. When using an alcohol swab, wait for the alcohol to dry before injecting yourself. It may sting less. Avoid injecting in the roots of body hair. People who take insulin daily should rotate their injection sites. This is important because using the same spot over time can cause lipodystrophy. Also check the skin integrity before administration of the injection. These are the rotation sites for insulin. Before injecting insulin, be sure to check its quality. If it was refrigerated, allow your insulin to come to room temperature. If the insulin is cloudy, mix the contents by rolling the vial between your hands and fingers for a few seconds. Be careful not to shake the vial. Short-acting insulin that isn't mixed with other insulin should not be cloudy. Do not use insulin that is grainy, thickened or discolored. Hand washing is a must procedure to ensure both the safety of patient and the medical professional. These are some nursing responsibilities. Monitor patient's response to therapy, monitor for adverse effects, evaluate patient understanding on drug therapy. Now I would like to conclude. Injections of insulin can help to treat both types of diabetes. The injected insulin acts as replacement for supplement to the body's insulin. Therefore, proper identification of site and proper techniques are necessary. Thank you for listening patiently. Have a very nice day.